Massage techniques. Massage uses a combination of movements to manipulate the tissues for both local and overall effects and benefits. These movements may be varied to adapt the treatment session to meet the client's needs. A therapist uses a massage medium to help their hands to move freely and smoothly over the client's skin. Common mediums used are massage oil, massage cream, or powder. All massage mediums should be first dispensed into the therapist's hands rather than straight onto the client's body. The oil, cream, or powder will be cold and needs to be warmed up and distributed evenly first. The massage movement effleurage is normally used for this purpose. Effleurage. Effleurage, otherwise known as stroking, is performed with varying levels of pressure. It is used at the beginning and end of a massage. It can also be used with firm pressure over large areas once the muscles are relaxed. Unlike some of the other strokes, effleurage does not aim to move or manipulate tissues or muscles, only to soothe and relax them and improve circulation. Effleurage is also used as a connection stroke between different parts of the massage and can be used to prevent loss of contact with the client when moving around the body. As it is often the first contact between therapist and client, effleurage helps to prepare the body for massage, introducing the client to the therapist's touch, spreading the massage medium, warming the muscles, increasing the circulation, and relaxing the client. It is also used after more invigorating strokes to help the elimination of toxins, in particular lactic acid. Such stiffness is often caused by the buildup of toxins such as lactic acid. Petrissage helps to release and break down these toxins, enabling the muscles to work more efficiently. It also stimulates the circulation and is very useful in sports massage. Despite the firmness of the stroke, it is more relaxing than invigorating because it releases any tight muscles and tension within the fibers. Friction. Friction techniques are all variations of rubbing, and they work by compressing tissue against bone. It is often used for close work on small areas or on specific areas of tightness or injury. Friction movements heat up the local area, improve circulation, promote lymph drainage, stimulate the nerves and loosen tightness in the muscles. On tight muscles, friction can be very painful, so caution is vital in the care of the client. Physiotherapists use this technique extensively in the treatment of injuries. Percussion. Banging on the tissues. Percussion techniques are brisk, invigorating and stimulating strokes, which use the hands to strike the body rapidly and suddenly, like beating on a drum. The classic chopping motion associated with Swedish massage is a percussion technique called hacking. The others are pounding, beating, cupping, and tapotement. Pulsemore can be used on smaller areas, such as the face. Percussion should be used as an invigorating wake-up stroke. If the aim of the whole massage is to stimulate the system rather than soothe it, percussion should form the major part of the treatment. If the aim of the massage is to soothe or relax, percussion can be used towards the end of the treatment, before the final effleurage strokes to wake up the client's systems. It should not be used on bony or delicate areas. It improves local and overall circulation, warms the skin and muscles, improves muscle tone both because of the physical effect of the treatment and the improved circulation, and helps break down adipose tissue. Vibration. Vibrations aim to clear the nerve pathways by making the muscle tremble in order to loosen tightness and release tension. Vibrations can be used when muscles are extremely tight and not responding well to petrissage or frictions. Vibrations help release pain and tension. It can be a very soothing technique or a very stimulating one, depending on the desired result. It can literally surprise the muscle into releasing its tension. Passive joint movements. Passive movements require the client to relax and let the therapist gently take a joint, for example the wrist, through its natural range of movement. The movements may help to improve mobility and release tension. They must never be used where joint problems already exist. Remember, massage movements should always be used with upward pressure towards the heart. This helps venous return and lymphatic drainage. During a massage session, the therapist should always aim to keep at least one hand in contact with the client to prevent interrupting the mood of relaxation and to reassure the client. Percussion and pétrissage should not be used on bony or delicate areas. The therapist should start with light strokes and gentle pressure and build up to deeper strokes and firmer pressure whilst maintaining a slow rate and rhythm throughout. Therapists must take care of themselves by continuously adjusting their own posture throughout the treatment. Ensure that your own body does not touch the couch or client at any time. The massage treatment environment. Massage requires the client to be partly or completely undressed. Underwear must be kept on. Therefore, the treatment room should be private and without the risk of interruption. It should have enough space for the couch and trolley and allow the therapist enough room to work. It should be an ambient temperature, as it is important to keep the client warm throughout the treatment. Additional blankets may be required to cover any towels used for this purpose. The lighting should be indirect and conducive to relaxation, but bright enough to work. A trolley, stocked with required consumables within easy access, prevents unnecessary interruptions or loss of contact during the massage. To perform a massage comfortably and effectively, a height-adjustable couch covered with towels is recommended. Couch roll can be used to prevent the towels being stained by massage oil. The towels should be changed for each client. The couch should be firmly padded, easy to clean, and wide and long enough to accommodate different clients. Some couches have a face hole with a flap to enable the client's head and spine to remain aligned when face down, but not all clients will require or like this. The therapist should also be comfortable and not straining or overstretching to perform the treatment. A couch that can be adjusted to the right height for each individual prevents such problems. The couch should be at the therapist's hip height, and the therapist should be able to extend an arm and comfortably place the palm of the hand flat down on the couch. Pillows will help both the client and the therapist. For a massage on the back, pillows or rolled towels under the shoulders and ankles will help improve comfort. Use of a face hole will keep the head and spine aligned during a back massage. A pillow can also be used under the chest for client comfort. For a front of the body massage, a pillow or rolled towels under the neck and the knees will provide support, relaxing the back and preventing strain. Towels are required to cover the parts of the client that are not being massaged. The treatment environment should be kept clean at all times, and the therapist should pay attention to his or her personal hygiene, since they will be spending intensive periods of time in a confined space with the client. Good hygiene is essential for ensuring a professional image and protecting the health of both the therapist and the client. Suitable methods of sanitization need to be kept on the trolley for use during the treatment. Massage is a very physical treatment. It is important that therapists pay attention to posture, working position, and exercise to prevent short and long-term damage to their own health. Use of the correct posture enables the therapist to perform to the best of their abilities without harming his or herself. If the therapist is balanced, with weight evenly distributed through the legs and pelvis, working in a flexible and relaxed manner, the massage will be smooth, rhythmic, and flowing. Good posture and the correct working position enable the therapist to concentrate on the massage without worrying about their own body and whether they will be able to perform the movements. It is important for the therapist to perform the massage in a centered, secure, and calm mood. Therapists must focus on using positive physical and mental energy to work on and improve the health of the client. A massage therapist will also need to take regular exercise in order to have the physical fitness and stamina required to carry out several treatments. Exercise also enables the therapist to relax and prevent a build-up of tension and stiffness in their own bodies.